This month, the NFL Players Association updated its concussion protocol to better protect players. KCTV5's Carolyn Long sat down with a local doctor to discuss how you should look out for those warning signs in your child athlete.
The sports world watched in horror when Miami Dolphin quarterback Tua Tagovailoa was so violently thrown to the field that he lay contorted with a brain injury, had to be carted off the field in a stretcher. It renewed the scrutiny against the NFL and its concussion protocols, even those on the high school level. The Journal of Pediatrics says as many as 1.9 million kids suffer a sports-related concussion each year. So gone are the days of telling athletes to just brush it off. Even though you got your bell rung, get back out there.
I tell patients on a daily basis to watch for or anything that shows up as a change in your child's behavior. If it's an emotional thing, if they feel like there's a headache or sleep disturbance, any of those things that are abnormal, that would be the thing that would be the first thing to set off the little bells to say, oh, there's something going on here.
Nationally known sports medicine specialist Dr. Dyck with HCA Midwest Health says although the majority of these athletes will recover quickly and never lose consciousness, others may experience physical, cognitive, and neurobehavioral difficulties related to the injury.
If your child comes home with this confusion, any nausea or vomiting, those would be immediate signs to have them evaluated. And the evaluation process could be in with your primary care physician the next day. If it's something that the symptoms continue to worsen, I would say, get them to the emergency room.
As for the pros, Dr. Dyck thinks the NFL is making good strides in protecting and testing athletes both pre and post concussion, no longer trusting a few simple questions of the athlete themselves.
Well, I think the NFL has the right idea at this point where they are employing some specialists to look for changes in the athletes throughout after their games and stuff. The issue generally comes up with athletes who are professional athletes. They're getting paid to play. So, if you ask them, are you hurt, and they want to be in the big game, they may not give you the right information.
So it takes the entire village, physicians, coaches, players, parents, the school, anyone who has a role with the athlete's circle of influence. And while helmets and protective gear have come a long way, they can only do so much.
The problem with that is that the brain is not a fixed object. It's mobile. It's in the skull. And so it's going to move. Anytime you introduce a force there, there's going to be some injury.
Bottom line, when in doubt, sit them out and allow ample time for rest and healing before a healthcare provider decides when to return to play.
Remember, we can replace a knee. We can't replace the brain.
Carolyn Long, KCTV5 News.
For more from HCA Midwest Health, you can go to kctv5.com and click on It's Your Health.